Welcome back, students. I have zoomed the area a little to show you the very minute structures here. What I did was that this levator palpebral superioris and the superior rectus I cut. When I was cutting, the superior division of oculomotor nerve was penetrating the superior rectus and supplying the levator palpebral superioris. Then I have just reflected these two structures and just to expose the deeper structure to this, and here I got is the superior ophthalmic vein, which is abnormally dilated and it is crossing to the optic nerve. And where is the optic nerve? This is the optic nerve. This is the posterior part of the eyeball here, from where posteromedial aspect the optic nerve is coming. And after that, what I got was that there was the ophthalmic artery. Can you see this? Ophthalmic artery was also crossing this optic nerve, and there was the nasociliary nerve. You can see this very delicate nasociliary nerve which was giving the anti and posterior ethmoidal nerve here, and it was going into the ethmoidal air sinuses. So this is the nasociliary nerve crossing the optic nerve from lateral to medial side, and this is that ophthalmic artery and lot of its branches I have removed in removal of the retrobulbar pad of fat. Okay, so while I was removing the retrobulbar pad of fat, I have just removed it. Now what I am going to do is cut this superior ophthalmic vein, which is abnormally large and interfering in the dissection. And now here the optic nerve is clear. Now I can show you the lateral rectus muscle on the lateral side. You can see here, this is that lacrimal nerve in my forceps is going towards the lacrimal. It was followed by the artery and vein also, and just below that, this muscle which I am holding in my forceps is the lateral rectus muscle. Okay, I will just show you this it clearly, and from its the medial surface where the abducent nerve is penetrating it. If you can see, this whitish spot is the abducent nerve in the lateral rectus which is penetrating. Similarly, I will show you the presence of this muscle which I have already shown you. It is the superior oblique muscle on medial side, and I have traced it as it is going towards the pulley. So this is that muscle, the superior oblique muscle, its tendon you can see here. See this superior, and if in its posteriormost part on its superior border there is a very light color, this trochlear nerve, the cranial nerve 4, which is in my forceps here posteriormost, and this lies onto the superior border. See this whitish structure, it lies on superior border. That is the fourth cranial nerve, trochlear, supplying to that of the superior oblique. And just below and medial to it, I could clean this muscle. This is the medial rectus muscle. I will further clean it as I will trace it forward. So this aponeurotic tendon has already started forming, and this muscle in my forceps is the medial rectus. Now what I am trying to do is that I will try to find out the ciliary ganglion which lies between the lateral rectus here, this between lateral rectus and the optic nerve here, its connection with that of the nasociliary nerve, and this was the nasociliary nerve in my forceps. This was the ophthalmic artery. So in this angle, very carefully I will try to find out the ciliary ganglion, and then I will go to dissect the inferior rectus muscle after cutting this optic nerve. Okay, so let me find out if I can find the ciliary ganglion here. Well, dear student, I will try to show you the ciliary ganglion. This was our nasociliary nerve. I have dissected this nasociliary nerve much posteriorly. See this trunk of the nasociliary nerve, and a branch going from connection, and this flattened structure here, okay, at the tip of my forceps. Of course, the short ciliary nerve seems to be coming out. This not very clearly, but I hope that the short ciliary nerves were broken from its point, okay, where this flattened structure is seen in the hanging, this one, hanging from the nasociliary nerve. This is the position between the lateral rectus and that of the optic nerve here, okay, more posteriorly. I have opened the optic canal for some distance here. This is there, but I am not 100% sure in this case, okay. So this is the site where you will get the ciliary ganglion, which is a parasympathetic ganglion, sending from here the postganglionic fibers through the short ciliary delicate nerves here, okay. This very delicate nerve, short ciliary, which will arise from this ganglion, and they will go to the posterior aspect of the eyeball, will pierce the sclera, and then will supply the smooth muscle of the eyeball, that is iris and the, I mean to say, ciliary bodies, okay. Okay, now I will dissect the remaining part of it. I will just cut the optic nerve and will reflect the eyeball, I mean to say push the eyeball forward so that you can see the lateral, inferior and medial rectus properly. Okay, I will come back after 5 minutes. Yes, students, I have exposed the 3 recti. This is the medial rectus. See this, which is in my forceps. I hope the light is going inside and you are seeing. This is the medial rectus. Its lateral surface is here. This was the superior oblique muscle, and this is the medial rectus. In the depth of this, if you can see these fibers, and this was the inferior rectus. I am just pulling it, okay, with the help of my forceps. You zoom it and please see it. This is the inferior rectus muscle going to the eyeball. Now I will show you the lateral rectus muscle, which was not seen clearly previously. Now this muscle, okay, just I am lifting here. This is the lateral rectus, and I can see also the abducent nerve going on its medial surface. I will just pass the tip of my forceps. If you can see, I am holding the this nerve, okay, at the bottom of this, I mean say on the medial surface near its base, okay, and this nerve is penetrating this abducent nerve, that whitish thing. It is going inside the muscle, that is the lateral rectus muscle. So you have seen all the muscle, levator palpebral superioris, superior rectus, lateral rectus, I mean say superior obliques, the medial rectus and the inferior rectus. Now only dissection which remains in the contents of this is the lacrimal nerve as well as the inferior oblique muscle, which I will try to show you from the anterior dissection, okay. So I am coming back. Now students, from the front I have dissected near the medial angle and inferior orbital margin this muscle, and this is the inferior oblique muscle which is going below the eyeball, that means the retro direction of this backward and laterally. This muscle is the inferior oblique muscle. Similarly, I have exposed near the lacrimal fossa the gland here, and this gland is the lacrimal gland. This was found very deep. You can see this is that lacrimal, atrophied lacrimal gland. This cadaver is of the old, very old lady with the emaciated muscle. That's why I found lot of difficulty in dissection of the orbit also. But you can see here the inferior oblique muscle, and this is that gland, the lacrimal gland. You can see that part which is lying into the orbital fossa. Thank you very much for watching this video.